Have you ever noticed a painless bump on your eyelid, which slowly grows but doesn't go away for weeks? It might not be an infection. It could be the Chalazion. In this video, we are going to learn about the Chalazion. What is Chalazion? Why it happens? The clinical features, the signs and the symptoms of Chalazion, the home remedies, and the treatment of the Chalazion. So Chalazion is a non-infectious chronic inflammatory lesion of the eyelid. And in simple words, the Chalazion is due to the blockage of the oily gland, which is called the Meibomian gland. So, if I invert my lower eyelid or upper eyelid, you can see the orifices or opening of the Meibomian gland, which is the gland of the oil. And what is the role of the gland of the oil or oily gland in my eyelid on my tear film? You know very well that the oil prevents the evaporation of the tear film. You can see, consider this opening as my orifice of the Meibomian gland. So for example, due to some reasons, due to some certain reasons, if this opening of the gland, Meibomian gland, is closed or clogged, the oil will accumulate over here, right? And during accumulation, it will look like this. It will make a bump on the eyelid, a nodule on the eyelid, and this is called the Chalazion. So very important thing about the Chalazion is it is totally a painless nodule on your upper eyelid usually, right? And it is, chronic. Chronic means it happens slowly and progressively, right? It is not an acute condition, sudden condition. It is not a sudden condition, right? So the Chalazion is not an active infection. There is no any bacteria or certain viruses are involved in the Chalazion. And now we will talk about the causes of the Chalazion, right? And the first cause, as I said earlier, that the blockage of the Meibomian gland, right? And the next is the poor eyelid hygiene, right? And if you have previous blepharitis, if you have previously got some Stye, right, Hordeolum, this can cause, the Chalazion as well. And after this, if you have oily skin and if you are living in a dusty environment, this can cause the blockage of the Meibomian gland, and this blockage of the Meibomian gland can cause the Chalazion. And now let's discuss about the types of the Chalazion. There are two types. One is external Chalazion and number two is the internal Chalazion. If you talk about the internal Chalazion, it is about the internal surface of the eyelid, the inner surface of the eyelid. Like the real Meibomian gland is in the, tarsal plate of the Meibomian gland. So the inflammation or blockage or clogging of this internal portion of the Meibomian gland is called the internal Chalazion, right? And if you talk about the external Chalazion, it's on the surface of the eyelid, like on the orifices or opening of the Meibomian gland. So this is the basic difference between the inner and the outer Chalazion. And let's talk about the stages of the Chalazion. And the first stage is called the basic and the initial stage of the Chalazion. And that is small, painless and swelling on the eyelid, mild heaviness in the eyelid, and the minimal discomfort on the eyelid. This is called the early stage. And now let's talk about the second stage, which is called the progressive stage of the Chalazion, right? And in the progressive stage, there are gradual increase in the size, firm, well-defined lump on the eyelid, and this is usually without any pain, and there is no any pus formation in this stage. And now the late and the severe stage, which is called the third stage. And in this stage, we got the large visible eyelid swelling, and after that, it looks very bad cosmetically on the eyeball, right? And it may cause blurred vision due to the pressure on the cornea, right? And the common refractive error which can cause, and that is called, the astigmatism. And the pro-clinical tip about the Chalazion and the Stye, the Chalazion is always a lump which is painless, but the Stye is painful. And now let's talk about the different home remedies in Chalazion, right? If the stages are early, then you can go for the home remedies. Like the first home remedy is, the warm compression, right? You can pour warm water on a towel and you can put warm water on your eyelid like this, right? And it will help you to prevent the blockage of the eyelid. So you can perform the warm compression in 3 to 4 times daily. And the next step in home remedy is gentle massage, right? If your Meibomian gland is clogged, you can make a gentle massage on your eyelid, right? And it will also help to prevent the blockage of the Meibomian gland. And after that, please, if you have a Chalazion, do not squeeze that Chalazion, right? You just make a simple, a lighter and gentle massage on your eyelid. And please do not squeeze that Chalazion. Chalazion is not a pimple, so please do not squeeze. And if your Chalazion is not resolved with this conservative treatment like massage and warm compressions, you can go for the medical treatment. And the first line of management in Chalazion is, the oral antibiotics, right? And if it doesn't work, you can go for topical eye ointment and the antibiotics as well, right? And after that, there is a swelling, and you can go for the steroidal injections as well. And if the recurrence of the steroids is over and over again, then you can go for the surgical procedure, the incision of the Chalazion as well. So now you have understanding about the Chalazion. What is Chalazion, why it happens, and what is the treatment methods in the Chalazion. Remember, the early detection of the Chalazion with the warm compression can prevent the progression of the Chalazion, right? And it can make you prevent from the surgical intervention as well. So if you like this video, please share with your colleagues.